My name is Amol Nirgurkar. I'm the CEO of Patient Prism, and I'm discussing all things DSO with Mitch Olan from Dental Care Alliance. And one of the big topics of discussion today is the amount of activity that's going on, deal making that's going on in the DSO world. You were saying in an earlier segment that there's 50, 60, 70 private equity groups now involved in some part in owning dental support organizations. Mm-hmm. So the topic really is selling to private equity, right? I mean, as you grow your practice, you're building a DSO, you're converting yourself into a DSO, and a private equity group comes in and says, okay, we're gonna invest in you, in your organization, and obviously the multiples are pretty lucrative these days. So how do you think about this? What do you think about getting a private equity group involved, and how do you what are the tips that you can provide these guys? How do you get a higher valuation? What do you need to think about when a PE group gets involved in talking to you?
Yeah, you're right. The amount of private equity funds that are flowing into the dental space is just it's beyond comprehension. I mean, I sit and talk to some of my colleagues that have been in this for 20 plus years, like I have. And we're all sort of scratching our heads over what's happening in the marketplace. None of us saw it coming. Sure. But when you think about it from a private equity standpoint, you're dealing with a very fragmented industry that is it's a relatively large industry with about sure. 130 billion in revenue. So there's a lot of what they call green space for growth within the private equity world, and that's what's attracting them to this space. But partnering in with the right private equity firm is critical, sure. And I think it's important to know what you want out of that relationship. Sure. They all have capital. That's right. Easy. All right. I mean, do you need a private equity firm that's going to bring you some operational expertise, sure. Or some back office expertise? Do you have a DSO to start with? Do you have some offices to start with, or do you just have this idea that you want to go and be a DSO and sure. Go to a private equity firm and take down some money? Because there's some of that going on too. And and candidly, those are from my perspective a little bit scary because folks are getting involved in the space thinking that it's an opportunity for to cash in and it's sure. Going to be easy, and it's not. This is a very challenging business. It's a very challenging industry. You got to take care of the patients. You have to take care of the affiliated providers and your staff, and there's a lot of juggling here. It's a human resource business. So just looking at it and saying looking at some of the multiples also are very much based on the size of the DSO, the infrastructure of the DSO, the type of patients that they're serving. Sure. The scope of the DSO, or is it just one market, or is it are they in multiple markets? Is it Medicaid, government based, or is it sure. Fee for service? Is it multi-specialty? There's a lot of things that come into play, and there's a pecking order there that really is. There's a system that can push up the higher multiples. Sure. What everybody wants to use is they want to use the multiples that are being given or been gotten by some of the larger deals out there, and then sure. Say, all private equity deals should be run at that, and they're not. And it's that's important for those that are looking to get into the space as well as those that are in the space to understand sure. What the value of their DSO is based on those parameters. And if they have any question about it, they should be talking to an investment banker to really get some guidance because I think that there's there's some misleading information out there that just everybody thinks that if they have $1, it's worth 10, and it doesn't work that way.
Does it make sense to involve an investment bank, especially if you have a decent size operation, to kind of represent you in negotiations with? And should you run a process?
A process isn't easy, and you don't always end up with the right partner. Look, I mean, the process is expensive, right? And there have been groups that have run a process and they've had a broken process, and that right. Means that they don't find that sale. They don't execute on the deal, and it ends up costing them a lot of money. And I've seen it really handcuff some small DSOs that are not necessarily cash rich. A banker will give you the guidance. A banker is going to be somebody that can, hopefully learn from their experience. They'll position you, they'll help market you, they'll bring certain suitors to the table. It doesn't guarantee that you'll close on a deal. There are a lot of DSOs out there that are in the affiliation world. Then you can do a little bit of homework and find out who they are, who's
Sure.
in the marketplace that you're in, and it might behoove you to talk to them first before you retain a banker. See what they're all about, and you might be able to step around having a banker altogether.
Right.
You just bring in the attorneys, obviously,
Sure.
and at the end of the as if it's somebody you want to talk to in greater detail, you bring in the attorneys, and you can work around having a banker.
I mean, it's really important, though, right? As you said earlier, that it's not just about the valuation. It's about sometimes you have to understand how involved this private equity group is going to be in your organization, and are you comfortable with their philosophy? Because there's the dichotomy between you're a clinician and that they're financial folks, and you have to kind of meet in the middle and make sure that spreadsheets are not going to run your organization sometimes.
Right, and that's the great rub with private equity. I mean, I've been at this long enough that when private equity first started coming into the dental space,
Sure.
it was the arrows that were being slung at the industry was essentially you're just in it for the money.
Sure.
It's all about just the money, and that's not the case. Private equity, the right private equity partner is going to provide you with resources to grow your business. And you have to understand who the right private equity partner is for you, and that's going to differ from individual to individual, group to group. And you need to do your homework on them. I mean,
Sure.
when we looked at bringing in private equity, we talked to their, some of their portfolio companies or former portfolio companies, and
Sure.
got on the phone with the CEOs of those organizations, and tell me, what was your experience? They'll give you a list of references, but
Sure.
don't just use the list that they give you. Ask for a list of all of their portfolio companies, so you get a true feel for how it worked out with those organizations when they came in and invested. Did they do what they said they were going to do? Did
Sure.
you get the desired outcome? Or did they come in and immediately start doing things differently than they said they were going to do? And I've seen some real horror stories transpire in the dental space, and I've seen some tremendous success stories.
Sure.
And DCA has been one of those. I mean, I'm very proud of what we've been able to accomplish with now our second private equity partner,
Sure.
and our first private equity partner was fantastic. But we vetted both, and we made sure that they were the right partner for us at the right time.
Well, it's fantastic. I think the private equity is a discussion that we could have all day, but these are good topics. I think a lot of people who are in this space trying to talk to these guys, and Mitch provided some interesting insights in terms of, do your due diligence, ask around, talk to the portfolio companies, and not all evaluations are going to be equal. Understand what the goals are, make sure they're aligned, and see if the marriage is going to work, because it's sort of a marriage, right?
Mm-hmm.
At the end of the day, you want to work together to build a great organization that's going to serve patients better, and that's the goal. And obviously make money in the process, but in the meantime, improving the organizational infrastructure to serve your staff better, your clients better, your customers better. So thank you for this wonderful discussion.
My pleasure.
I enjoyed it.
Thanks
Thank
for
you.
having me.
Thank you.